Bleeding after menopause is called postmenopausal bleeding. Of course, it is not normal at all. The reason being, bleeding stops when the hormones in the body stop being produced. That's when menopause happens. And if you bleed afterwards, there is 1 in 10 risk of having cancer. That's why it needs to be investigated very, very urgently. The national recommendation is that anyone with postmenopausal bleeding should be seen within 2 weeks in secondary care. So the answer is yes. As soon as you see postmenopausal bleeding, you should see a specialist. So the most common causes of postmenopausal bleeding are still benign, because 9 out of 10 cases will not have cancer, but 1 out of 10 cases will have cancer. And the common benign causes are atrophic vaginitis. That means when the skin of the vagina and vulva becomes very thin and it can start to bleed because of small cracks within the skin, or polyps, which are also benign, can cause this kind of bleeding as well. But as I said, 9 out of 10 cases will be benign. Thanks. Postmenopausal bleeding, yes, it can stop on its own if the cause is atrophic vulvovaginitis, which means when the skin crack heals, it will stop on its own. However, if it is because of precancer, hyperplasia, cancer, or polyp, even if they are benign, it will not stop on its own. So the gold standard test for postmenopausal bleeding is ultrasound scan. Ultrasound scan gives us estimation of endometrial thickness. Endometrial thickness is thickness of the lining of the womb, because that is responsive to hormones, and that's what we want to check. Is there any increase in thickness? And the normal thickness is 4 millimeters. Anything more than 4 millimeters can be associated with pre-cancer conditions and cancer. And once the ultrasound scan is done, the next step is local examination to see if you're bleeding locally from vulva, from vagina, because of atrophy. And the third test, if the ultrasound scan shows thickness is more than 4 millimeters, then again, the gold standard is hysteroscopy, where a camera goes inside the neck of the womb. We have a look inside, and if there is any abnormality, we remove it at the same time as well. So postmenopausal bleeding, we need to investigate the causes of postmenopausal bleeding first. As I said, ultrasound scan, local examination, and hysteroscopy. And hysteroscopy is not only investigative, it is a treatment modality as well, because if we see any abnormality at the time of hysteroscopy, we will remove it, which can be polyp, which can be endometrial hyperplasia, or any abnormality. And once the removed tissue is checked in the laboratory, and if that is normal, then we don't need to do anything. And in most cases, bleeding stops at that stage.